Hello everyone, I'm Dr. Ibrahim, and in this video I will talk about PLAB 2 exam. I will try to cover all the detail you need to know about the whole journey from the start till you get your result. And unfortunately, one of the major mistakes a lot of doctors do in the start of their journey, they start directly by studying the notes, attending the academies and taking the course without trying to even know the details, the structure of the exam itself. So it is very important to know this detail, and alhamdulillah, I passed my exam with high score, so I will try to add some extra information that will help you to minimize your effort and get high score. The best place and the best source to know about this exam is from the GMC website itself. In the GMC website, they explain all these details. So after watching this video, please read this information again and again and again. Even if you already started your journey, even if you went through this journey before and you failed the exam, it will help you a lot to enhance and increase your level for the next attempt. Okay. So let's start. What is PLAB 2 exam? PLAB 2 is an objective structured clinical exam. It is an OSCE exam composed of 16 scenarios, each scenario lasting up to 8 minutes. And the aim of this exam is to reflect a real life setting, including mock consultation or an acute one. Okay, so it is 16 stations. Each station lasts for 8 minutes. And the main purpose of this exam is to reflect how you deal with the patient in a real life setting, in the clinic, in the hospital. So you need to deal with the whole situation, as it is a day in the clinic, not it is like an oral exam and you just memorize the information and you went through the exam and tell the simulator this information. You need to approach the patient or the simulator as he is a real patient in your clinic or in your hospital. You need to deal with the whole situation as it is a day in the clinic. If you do it like this, you will pass this exam easily. Okay. So what does this exam cover? The exam covers everything a UK trained doctor might expect to see. So a UK trained, so all the information a UK trained doctor must know to see in the first day of foundation year 2. So in all station, you will be FY2 doctor. In all station, you will be FY2 doctor, okay? So it is fixed in all station. And this exam, this is your ability to apply the knowledge to the care of patients, not how well you can remember and recite these facts. So is as I mentioned, how to approach the whole situation, how to approach the patient, how to take care of your patient, not just to memorize the information and tell it to the patient. It's not just like this at all. Because in some situation you may not know the whole station. What is the diagnosis here, or even you forget the diagnosis, or even you don't remember the management or the treatment. So you need to learn how to deal with the situation like this. You need to learn how to deal with the situation like it is a real situation. And all the questions related to current best practice, you should answer them in relation to published evidence and not according to your local arrangement. So it is not according to your country and even not according to the arrangement of your information, because a lot of doctors rearrange the information in order to make it easy for them to memorize it. But sometimes you need to mention the management as it is written in the note or is written in the source you study from it. Okay. And the name of the drug referred to the exam to end the exam are those contained in the most recent edition of British National Formulary, BNF. And by the way, all the cubicle contain a copy of this BNF. and it is available for you to open the BNF at any time of the station. Just excuse the patient and open the book and search for the drug you need to know about it. We will come to this later. You don't need to open the BNF in each station. I will tell you some information. It will make it easy for you to deal with this. Okay, so this is the information that will be covered in the exam. Okay, how do you answer the question? You will have 1.5 minutes between scenarios to read the instruction and the patient information. You will then enter the exam cubicle and complete the task. Okay, so I started the first station. Before the start, I will have 1.5 minutes to read. This is the scenario. It will be beside the door of the cubicle. So you will read the scenario. You will take 1.5 minutes to read the scenario, and after that you will enter the station, and you will say your name and your GMC number, and after that you will start the station. It will take 8 minutes to finish the station from entering the cubicle till finishing the station. Okay, so you will then enter the exam cubicle and complete the task outlined. Okay, also one of the major mistakes a lot of people do in this exam is they try to deal with the station as it is mentioned in the notes, but it is totally different. So one of the most important and the secrets of this exam is to read the task again and again and again. Okay, because sometimes they bring a scenario and you think you will manage this scenario, you will prescribe medication, and it's just for follow-up, or even it's just a breaking bad news, or even it is an angry patient. So read the task again and again and again. Okay, at some scenarios you will just give some advices to the patient. It is important to read the task. It will make it easy for you, and you will not waste your time by reading the task. Okay, one of the secrets of this exam also is try to forget all the information of the previous station. Try to refresh your mind. I mean by that, you already finished the first station and you're about to enter the second cubicle. Try to refresh your mind and try to not to think about the previous station, because you don't have any time for this. This 1.5 minutes is very strict time to read the new station and to arrange the question, just to think about the new station. So you don't have any time to think about if you try to think about the previous station, you will lose the next one. There will be at least 2 rest stations, allowing you to take breaks. The whole exam will take around 3 hours. Okay. So some people have the rest station in the start of their exam. Some people will have the rest station after 5 station, after 9 station. For me, it was after 10 station. And you are allowed to drink water, and they will give you some cookies, and also you are allowed to go to the toilet if you need. So just ask for it. Try to rest. Try to relax. It's 8 minutes. So use this 8 minutes very perfect, because it will refresh your mind for the next one. Okay. So how you will be tested? Also, this is very, very, very important. This is the structure of the exam. And because of this structure, you will know how to arrange your time, to manage your time, and how to get high score, how to approach the whole exam. Okay, so we are dealing with a real patient in the clinic, but also we need to deal with the whole situation also as it is an exam. So we need to make balance between both of this. So first of all, you need to know the structure of the exam, the parts of the exam, in order to arrange your time according to the scores. Let's explain the structure first, and it will be easy to get my point. So the main domain, the main parts of the exam, the first part is data gathering, technical and assessment skills. The second part is clinical management skills, and the third part is general part, is interpersonal skills. Let me explain everything in detail. So data gathering and the technical assessment skills, it will be for 4 degree. The whole station is, the score of whole station is 12 degree, 4 for data gathering, 4 for clinical management skills, and 4 degrees for interpersonal skills. So again, data gathering, technical and assessment skills, it is only 4 degree. So don't waste your time to get only this 4 degree. You have 8 degree. You need to be as quick as possible in this part, because the main mistake in the exam, the major mistake in the exam, is that a lot of people waste their time just taking history. Come on, history taking is one of the many parts of data gathering. So in data gathering, you have history taking, physical examination, practical procedure, investigation leading to the diagnosis. Okay, so history taking is one of many parts of just data gathering. Physical examination is a part of data gathering, because in physical examination you find some some signs or some finding that will give you information about the case. So the part of data gathering. Practical procedure, in some situation, some stations like ANT station, you need to do some examination to get the information. Like in otitis media or in airwax, you may need to do air examination, do otoscopy to know the diagnosis of the station. So this is part of data gathering. Investigation leading to the diagnosis. At the end of the station, you will order some initial investigation. This is also part of data gathering. Ordering this initial investigation will help you to know the exact diagnosis, or to know even the provisional diagnosis of the station. So don't waste your time just taking history, because I do MOOCs with a lot of people. They consume like 6 minutes only to take history. 6 minutes only to take history. So 6 minutes for, even they may not ask a relevant question. So they will not even get the full mark of data gathering, because procedure, investigation. So don't waste your time. From my point of view, if it is counseling station or it is already diagnosis station, 2 minutes is more than enough to take history. Okay, let's be flexible. It's different from station to station, but the average must be like 2 minutes, 3 minutes. Okay, maybe in the first presentation station, like newly diagnosed, or the first presentation in this day, like the undiagnosed station, it is medicine station. So you may take more time, like also 3 minutes, 4 minutes is enough. And according to the session, for me in the exam, I just spent 2 minutes in the medicine station, and like 1 minute taking history in counseling or other station. Okay, you need to be quick as possible, and you need to ask relevant question. Don't consume your time asking about diet and exercise in the station. It is an emergency station. It is irrelevant to ask this question. So rearrange your notes to ask a relevant question. Okay. After that, we will come to clinical management skill. What is What's clinical management skills? Is formulating diagnosis, explaining something to the patient, formulating a management. Okay, so clinical management skills start directly after finishing data gathering. Okay, so you took history, so you examined the patient, you order some initial investigation. After that, you will tell the patient about your provisional diagnosis. And don't forget to ask the patient if he has any idea about the whole station. We will come to this later, to ask a patient about IS, the idea or concerns or expectation. And also it is different from scenario to scenario. Sometimes you need to ask the patient about the idea, sometimes you need to ask the patient about the expectation, about the main concern. So you need to be also flexible. Okay, so you need to be as simple as possible while explaining the diagnosis to the patient. Okay, try to minimize the usage of medical jargons. Try to explain the diagnosis to the patient in simple way. Try to explain the investigation to the patient in simple way. Try to explain the management to the patient in simple way, because he is not a doctor. He needs to understand this information. Okay, and according to his understanding, you will take some consent for procedure, or you will take his consent for admission. So you need to be as simple as possible. I'm not telling you don't say any medical jargon at all, but try to be simple. For me, I explained the whole situation first, and after that, I told my patient the medical jargon. So what's called in medicine, blah blah blah. It's called in medicine rheumatoid arthritis. Explained joint problem and like inflammation in the joint and the symptoms, blah blah blah, and what's called rheumatoid arthritis. So be simple as possible. Okay, so this is provisional diagnosis, explaining something to the patient. What's meant by something to the patient? Sometimes you need to explain to the patient about the risk factor. You already asked the patient about this risk factor in data gathering. So now you are trying to explain that this diagnosis is because of this risk factor. Okay. The risk factor may be a family history, or maybe smoking, or maybe some lifestyle changes. So try to explain it also as simple as possible. You may need to explain further investigation. You may need to take consent. You may need to explain a referral, okay, according to the situation. Also about the management, and in most stations, management is medical and non-medical. Medical management and non-medical. Medical management includes treatment, procedures, and some specific management plans for some patients. We will come to it later. And non-medical include lifestyle modification, safety netting about the condition itself, the risk factor for this condition, or the side effect of the treatment. Okay, so this is the second part, and nowadays the main concern will come in this part. The history or the question of the patient will start in this part. So try to be as quick as possible, as fast as possible during data gathering, because you need all the time while you explain to the patient about the diagnosis and about the treatment. Try to be as quick as possible. Okay. Let's go to the third part. It is interpersonal skills, and it is easy. It's easy if you try to deal with the exam as it is a real day in your clinic. Try to deal with the simulator as it is a patient in your hospital. Use the appropriate interpersonal skills. What is meant by interpersonal skills? How to approach the whole situation. how to deal with the whole situation, how to ask the patient in very gentle way, how to gain what you need from the patient in very gentle way, how to build the rapport with the patient, how to approach an angry patient, how to deal with your colleague in the hospital, your FY2 colleague, your nurse colleague, your senior, okay? How to deal with relatives, okay? And how to understand the rights of the patient, the ethics. You don't need to memorize books for ethics and the rights of the patient, but you need to just memorize specific stations, the ethics of a specific station, or the rights of patient in some specific station, and we will mention it later also. Okay, so interpersonal skills, the best way to do it is to relax during the exam. So you will not consume time on thinking because you already relaxed in the exam, and also try to work in your language. Uh, our language is uh, one of the main problem in the exam, because alhamdulillah, in my exam I didn't face this problem, but try to work into your language, make it easy, just understandable for the patient, so you will not consume a lot of time formulating the suitable sentence or formulating the suitable answer for the patient. You will consume this time to discover a new words, or just saying the appropriate answer to the patient. Okay, so interpersonal skills, it's very easy to approach in the exam, and it will be easy by practicing more and more and more. Okay, so this is the structure of the exam. So 4 marks for each part of the exam. So try to arrange your time. About interpersonal skills is a general part from the start of data gathering till the end of the exam. From just saying your GMC number and your name and saying hello to the patient and building a rapport to the patient till the end of the exam. Okay, and there is some specific interpersonal skills. I will tell you about it in each specific station. We will come to it later. Okay, so this is the parts of the exam. When marking against the domain, the examiner will assess your competency across a number of skill area. Okay, this is a clinical examination. Most of the station will involve simulated patients. You should interact with the actor as you would a real patient, including requesting to perform any relevant clinical examination. Nowadays, you will not do any examination. You just request it. Even if you are about to do this examination, it will be on a mannequin in the simulator. So in the station that you will do examination, try to be like a wolf. You will see a simulator, you will see an examiner, and try to search for a mannequin, because nowadays a lot of people reach the end of the station without saying, where is the mannequin? Where should I do the examination? Okay, so in examination station, there will be a mannequin. You will do the examination on it, but don't speak to the mannequin. Just speak to the simulator or to the examiner, and deal with the mannequin as it is a real patient. Don't say the mannequin, so I will be hard, or I will do it with without any restriction. Deal with the mannequin as it is a real patient. Okay. In some room, you will find the telephone-based station. And also nowadays, they increase the number of telephone station because of COVID. So you may see like 6 or 5 station. It will be telephone call. It could be any station. It could be even medicine station. Okay, could be breaking bad news station, counseling station, just telling the patient about the test result. Okay, it could be in a station, and you will deal with this station according to from which part. Is it counseling? We have a structure for counseling station. Is it breaking bad news? We have a structure for breaking bad news. And at the start of the station, we have a structure for telephone call. So first of all, we have a structure for telephone call. It is a fixed structure for telephone call. And after that, you have a fixed structure for which station. Is it counseling station? Is it breaking bad news station? Is it medicine station? So we will arrange it later on. And it will be written in the cubicle, and you will see only a telephone in the cubicle. So only you and the telephone. Okay. The telephone will put on a speaker. So you don't need to hang the telephone, just speak to the speaker. And I will give you some hacks to do while doing this telephone. Like if you can't hear the patient, just try to be near the telephone. Try to ask the patient to lower his or her voice. Try to ask the patient to repeat. We will explain this in detail. So in some station, you will be assessed in your ability to conduct a physical examination using a model or mannequin, because we have examination station. Okay, we have like some procedure. So the whole station will be about the procedure, but you will answer like 2 questions, or you will take some data gathering, you will take small history, but the station is all about the procedure itself. We expect you to be able to carry out any basic physical examination, including but not limited to examination of abdomen, breast, chest, hand, heart, joint. You must be able to perform a rectal or by manual vaginal examination. All this examination, you must know about it, and there is a specific videos, clinical videos for it. You must also be able to use appropriate equipment in carrying out an examination of the ear, eye, or nerve system. You need to see videos for it, or even try to practice or train on this equipment. You may be required to perform an examination or other procedure on a high fidelity simulator, which can be programmed to show normal and abnormal clinical signs, like Simman station. In every exam, you had the Simman station. Simman usually it will be emergency station, and also we have a fixed number of this station, like bronchial asthma, heart failure, hypoglycemia, anaphylactic shock, and there is ABCDE approach. It is very easy to deal with this station. A role player may speak from outside the room using a microphone connected to the simulator. You can find more information and videos in the manufacturer's website. It is about the Simman, and we will explain it in detail. Of someone's mental state is a form of clinical examination. Examination of someone's mental state is a form of clinical examination for the purpose of PLAB 2 exam. Okay. After that practical skill, you need to memorize this. This is a procedure, like checking blood pressure. Okay, so at the start of examination, you usually mention this vitals. Vitals include blood pressure, oxygen saturation, heart rate, temperature, breathing sound. So you need to check blood pressure. You will not do it, but you need to know about it. Performing vein puncture to take to start IV fluids, or to take a blood sample, inserting a cannula into a peripheral vein, calculating drug dosage. In some station, it is all about drug dosage, prescription station. Okay, so you will have a scenario, and you will have some notes, this prescription writing notes, and you will have the BNF with you. So you need to know about this station. Also, it is very easy because it is a well-known station. Even at some station, you don't need to open the BNF, because you will know the dosage. You need to act like you are opening the BNF. We will talk about it later. Giving intravenous injection, mixing and injecting a drug into an intravenous bag, giving intramuscular and subcutaneous injection, basic cardiopulmonary resuscitation, suturing, interpreting an electrocardiogram, and sometimes you need to read the ECG. Sometimes, like in some manifestation, you need to read the X-ray. Maybe you have a child with fracture humerus. Okay. Sometimes you need to read the ECG because the whole station is about ECG teaching to a nurse or even a medical student. Interpreting basic respiratory function tests, performing urinary catheterization for medical purpose, or even for taking for treatment, I mean by that, or even for taking a urine sample. So the whole station will be about taking a urine sample. Taking a cervical smear, so you need to know about Casco and how to use it. Safe disposal of sharps is one of the most important things you need to know about the whole procedure. The examiner will note how you deal with this sharps after doing like vein puncture. So you need to dispose all this sharps in the sharps bin. Okay. After that, the interpersonal skill. We test this skill by observing the interaction between you and another person. Maybe from the camera, or the examiner will be with you in the same room. Usually a simulated patient, or occasionally the examiner. This interaction can take place in person, over the telephone, or via video call. The examiner will assess your approach to the patient throughout the examination, even if they are not present in the room. Okay, so the type of the assessment, maybe through the camera. You will deal with the simulator, and the examiner will see you through the camera, or even the examiner will be with you in the room itself, or even the examiner may be the same simulator, the simulator itself, through a telephone call, or through a normal station, okay, or maybe through a video call. So they may include explaining diagnosis, investigation, and treatment. How simple, how easy, how the patient know the diagnosis. How did you explain the diagnosis and the treatment to the patient? And how you deliver this diagnosis to the patient, because in some station it is a breaking bad news diagnosis. You will tell the patient maybe it could be a cancer, could be something sinister. So how you deliver this information, involving the patient in decision making. So don't tell the patient, we will do a procedure, and take a consent from patient. And it will be easy for you to take the consent if you explained everything in simple manner and in detail to the patient. Okay, take a consent even for admission. Okay, take a consent for some treatment for the patient. Okay, communicating with relatives, as we mentioned, a lot of station you will need to communicate with the wife, the mother, the father, or any relative. Communicating with healthcare professional. Some station you need to communicate with your colleague in problem colleague station. You need to explain something to your colleague in teaching station. You need to communicate with senior. So you need to know how to deal with a healthcare professional, and how you break the bad news to the patient. We have many approaches for this, and by practicing, you will know how to deal and how to break the bad news to the patient. Seeking informed consent, as we mentioned, dealing with anxious patient or relevant. Sometimes we have some angry patient. Sometimes medical errors occur in the hospital, so you need to deliver exact information, the real information to the patient. You need to tell the patient that a medical error occurred and to apologize for the patient and to explain how you will fix this medical error in the future. So you need to know the approach of how to deliver this information. Giving instruction on discharge from the hospital, giving advice in lifestyle, health promotion or risk factors, giving advice on as we may use an anatomical model in some station, it is important to remember the following. Okay, don't speak to the model as you won't gain any marks from doing so. So the model may be only the chest. The model may be only the hand. It may be only the legs. So don't speak to the model. It is irrelevant. It is illogic to speak to the model. So you can speak to the simulator, because in some station you will have 3: simulator, model, and examiner. You can speak to simulator or even the examiner according to the station, and tell the examiner what are you doing and why, only if the instruction tell you to. Okay, so tell the examiner the steps if is written in the task outside the cubicle. Tell the examiner the steps or why are you doing it like this. Don't perform any action on anatomical models that would be unsafe or painful for real person. Okay, as I mentioned before, deal with the mannequin as it is real person. Okay, if it is painful for real person, so it will be painful for mannequin. Okay, so this is about interpersonal skills. Okay, so this is about PLAB 2 test dates and where you will take the exam. The last thing I just need to tell you about is the exam day. You may have one of two time exam. I mean by that, there is 2 exams in the same day. It could be in the morning. As I remember, it is 9 o'clock in the morning, or it could be in the evening, 1 p.m. in the evening, okay, afternoon. So they will send you email 1 week or maybe 5 days before your exam. So in the exam day, you will go the GMC building maybe 1 hour before your exam. You will sit in the room and they will tell you how the exam will go and how to deal with the station, and they will give you some tips and some advice about the day and how it will go. And it will be like for 3 hours. It is an easy exam, but you just need to know how to deal with the whole situation. You need to read this information again and again and again, and watch this video. And soon I will do more videos about each specific part of the exam. I will do some videos about counseling, medicine, breaking bad news about Sinman. I will give you some of my approach. It will help you a lot in your journey, and I wish you best of luck.